Okay, so one of the bizarro world situations that we are now encountering is that there's actually some good news on COVID. Like, there's actually some good news on COVID. So what is that good news on COVID? Well, there's a study that is now published in Science magazine, and it suggests that T-cell immunity is a thing. So there's been a lot of discussion about how you reach herd immunity with this disease. Does this disease hit herd immunity at 50% of the population, 70% of the population? If it takes all the way till 70% of the population, then you're talking about, maybe millions dead over the course of time in the United States. But what we have seen in places like New York and places like Sweden, and what we are seeing now in Florida and Texas and California, is that once the virus kind of works its way through a community, it doesn't have to hit 70% of the community. It only has to hit more like 20 or 25% of a community in order for the curve to start bending down. And folks have been wondering about this. They've been wondering, why is that? Well, one of the going theories has been that there are an enormous number of people who are just not hit hard by this virus, who are either asymptomatic or don't get it in the first place because they have something called T-cell immunity, meaning that their body has these things called T-cells, and these T-cells have already learned how to deal with coronaviruses. And coronaviruses would include like the common cold. So if you've had a common cold in the last 2 or 3 years, then your body has already learned how to fight off possibly COVID-19 is sort of the going theory. Well, now there's an abstract from a study that is in Science magazine, August 4th, 2020. And they say, many unknowns exist about human immune responses to the COVID-19 virus. COVID-19 reactive CD4 T cells have been reported in unexposed individuals, suggesting pre-existing cross-reactive T cell memory in 20 to 50% of people. Right? Meaning that maybe half the population already has some sort of pre-existing ability on an immune level to push back against COVID-19. The source of the T cells has been speculative. Using human blood samples derived before the COVID-19 virus was discovered in 2019, they mapped 142 T cell epitopes across the SARS-CoV-2 genome, SARS-CoV-2 is COVID-19, to facilitate precise interrogation of T cell repertoire. We demonstrate a range of pre-existing CD4 T cells that are cross-reactive with comparable affinity to COVID-19 and common cold coronaviruses. Thus, variegated T cell memory to coronaviruses that cause the common cold may underlie at least some of the extensive heterogeneity observed in COVID-19 disease. So this answers why some people are getting crushed by it and some people are just having like a mild cold and then basically being done. That's actual good news. Okay, that means that a huge swath of the population already has some pre-existing level of immunity to this virus, which is excellent, excellent news. And we have more excellent news. It now turns out that the numbers in terms of COVID-19 cases have been declining markedly, like seriously markedly, in Florida, in Texas, in Arizona. The Sun Belt, the surge is over. The surge is over. Now, there's talk about maybe a second surge in the winter, but that always presupposed that this thing would sort of die out in the summer because of the heat. And then when everybody was out, was in the cold, then people would be sort of in their offices, and then the heating systems would move this thing around. It turned out that sort of precisely the reverse happened. In order for the virus to be killed off by the heat, you have to be out in the heat, right? So it is certainly possible, and there's good data to suggest that in areas that don't have air conditioning, that heat is killing the virus. But precisely the reverse has been happening in the Sun Belt. Why? Well, when it's hot outside in a first world country like the United States, everybody's got central air, everybody's in the office, the air is circulating, and so you actually ended up with a surge during the summer because people were not in the heat. So in 1918, right, with the influenza pandemic, well, the flu pandemic was a different story. There was no air conditioning in 1918. It was reserved for super rich people. That meant that everybody was basically in the heat all the time, and the heat was killing this thing. Well, now that you live in a modern society with central air conditioning, when it's really hot outside, what do? You go inside. When you go inside, all of the virus gets blown around, and then you get an uptick. Well, the uptick is over in Florida. The uptick is over in Texas. It is over in Arizona, and it may, in fact, have peaked already in California. According to NPR, officials in Florida say cases of coronavirus are continuing to decline, an indication that efforts to halt the spread of the disease are working. Now, this is the part where media, I don't think that the media are being responsible about this. I don't. There's this idea that it was government intervention that is preventing the spread of the disease again, that everything was going wildly haywire, and then everybody stepped in and shut down societies again, and then the lockdowns crushed the curve again. That is not right. Look at the timeline. Okay, Florida really only began to crack down on particular activity about a week and a half ago. Okay, and the cases started to decline last week. That is not enough of a delay. If you actually want to see when the cases began to decline, the answer is once it started burning through the community. Same thing in Arizona, same thing in Texas. California never really opened, and California saw a surge, and then it saw a decline. It was not the renewed lockdown that caused a decline in California. So the media have this pre-prepped narrative that it is lockdown that slows the spread. But that's not what happened in New York. Lockdown didn't slow the spread. In fact, lockdown may have exacerbated the spread because everybody who already had the virus was then locked in their house with their elderly family members. Miami-Dade County has been responsible for 25% of the state's nearly 500,000 coronavirus cases, according to the mayor, Mayor Carlos Jimenez. He told commissioners that hospitalizations have been trending downward in the county for 2 weeks. For 2 weeks. Okay, listen to that. Hospitalizations have been trending downward for 2 weeks. Okay, I was in Florida until a couple of weeks ago. Everything was pretty much open. Right? They only shut down indoor dining. They had socially distanced indoor dining. They only shut that down like the last couple of days I was there. Right around the time I was leaving, that is when the hospitalizations started to decline. So it is not because they shut down the indoor dining that the hospitalizations started to decline. The hospitalizations started to decline before they shut down the indoor dining. By the way, the same thing is true in New York about mask wearing. So people keep saying, well, the mask wearing is what crushed the curve in New York. That is not correct. Look at the timeline. The curve already started to flatten before people started putting on the masks. Now, it's not a case against the masks. It's not a case against social distancing. It is a case that really the only thing that you can do with the virus is basically wait for it to burn through. That's pretty much all we know at this point. Slight delays may help in terms of allowing hospitals to better cope with this stuff. Hospitals have gotten a lot better at dealing with COVID-19. People are not dying in nearly the numbers they were. But the notion that it is the renewed lockdown that started all of this, that's just not correct. Florida Governor Ron DeSantis said, I think the trend is positive. I think we're going to continue to see the prevalence decline. DeSantis spoke in Jacksonville. He held a roundtable with advocates for the elderly and administration officials to examine ways to open nursing homes for family member visits. DeSantis said he wants to begin allowing people who test positive for antibodies to visit family members in long-term care facilities. He's appointed a committee of advocates and officials to look at other members to allow family members to visit nursing homes, which, by the way, would be a good thing. I mean, I have a couple of family members in nursing homes, and they're basically isolated. It's a terrible life. They've basically been locked indoors for 4 months without the ability to see other people. And if people have antibodies and they want to go visit grandma in the nursing home, that seems like good policy to me. So this is good news. Okay, we should be, like right now, yes, the death numbers on a day-by-day basis are not great because death is a lagging indicator. But we should be pointing out, what we should be excited about is the fact that there was a Sunbelt surge. It did not overwhelm the hospital system, and now it is going down again. And we should be pretty excited by the fact that the caseload was extraordinarily high in these states, and the death toll was actually not all that high in these states. I know there's been a lot of talk about, the evils of Florida and the evils of Arizona and the evils of Texas. We never talk about the evils of California, of course, because California is a Democrat-governed state. But if you still want to look, like, they experienced their surges. Okay, Florida had its surge. Texas had its surge. Arizona had its surge. I'm now looking at the list of states in the United States, deaths per 1 million population. Florida does not rank in the top 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18. Florida ranks 19th in deaths per million. 19th. Okay, for all the talk about how Florida was going to get wiped out. And by the way, Florida would have had every excuse to get wiped out, considering the fact that it is disproportionately the oldest state in the union. They have a huge retiree population in Florida. But contrast Florida's death per million rate at 345 to New Jersey's at 1,793, or New York's at 1,686, or Massachusetts at 1,256, or Connecticut at 1,245. Florida is ranked 19th. Okay, Arizona is ranked like 13th. Georgia is ranked maybe 15th. Okay, so for all the talk about these Sunbelt states that totally blew it, they didn't. They didn't. Okay, Texas is not ranked in the top 20. Texas is ranked like 27th. It's ranked about the same as California, actually. So this is all good news, right? What we should be rooting for is once people have experienced the curve, then that's the end of the curve. And in fact, this has become the going conventional wisdom. So I know that you've been told that the experts are for lockdown. The experts want lockdown. They want masks and they want lockdown and they want heavy government hands. They want now, let's be real about this. There are no experts on a brand new pandemic. There aren't. There are people who know a little bit more and people who know a little bit less. And there's a lot of controversy in the scientific field over virtually every aspect of COVID-19, including mask wearing. As I've said before, Holland does not mandate mask wearing. They don't think it's useful. Denmark does not mandate mask wearing. They don't think it's useful. Sweden does not do it. Netherlands does not do it. Right? None of these places do it. Okay, but I've said, out of an abundance of caution, if you want to go to a public place where you're near other people, wear a mask. My parents are wearing a mask when they are around my children because my children are back at camp. But there's also been this kind of going notion in the media that lockdowns are the best possible tactic. Dr. David Nabarro, who is one of the ambassadors from the WHO, he said we actually should try to avoid lockdowns at all costs. So this is now conventional wisdom.
Well, we would, in the World Health Organization, invite countries to do everything possible not to have these complete lockdowns. It's a very blunt tool. That's why we've said right from the beginning that the way you deal with this kind of disease is through having a really good strategy for finding people with the disease, testing them quickly and getting the results to them fast, tracing their contacts, doing the isolation properly, and supporting people, as you've just said, who are particularly vulnerable.
Okay, but testing and tracing is not really relevant in a country of 330 million people with probably 20 million infections running wild at this point. So the real answer is you protect the vulnerable and everybody else goes back to work. That really is the answer here. Okay, that's just that's going to be what it's going to be. And the good news is it doesn't have to burn through 70% of the population, according to the new data. Basically, T-cell immunity means that a huge percentage of the population is not particularly vulnerable to COVID-19. So President Trump said just this yesterday. He said, we now have a better understanding of the virus, and we are not pushing national shutdowns. It's not something that we're going to do.
So we closed it down, and we're now opening it up, and it looks like it's a V. It's absolutely a V. But we're not going back to shutdowns now. We understand the disease. We understand the problems with elderly, especially elderly with heart or diabetes or other problems, and we're able to take care of them. We understand it now, but we're not shutting down. We've done really very well. The numbers are looking very good, by the way, in Florida, Texas, and California. They're heading down.
He is correct about this. He is correct. And so the media have immediately shifted to their latest spin, which is that everybody in the Midwest is going to die. No, not everybody in the Midwest is going to die. There's going to be a surge in areas where there has not been a surge, and there will be some death, because whenever there is a surge in disease, there is some death. But it is not going to look like New York. It is not going to look like New Jersey. Hospitals have gotten better at this. It is not going to overwhelm the system. I'm predicting that right now, right here. Okay, you're not going to see an extraordinary surge in death. You're not going to see 12 New Yorks, as people were predicting like 2 weeks ago. Okay, so why isn't that good news? Why aren't we celebrating that? That would be a good thing, right? Why aren't Americans happy about this? Instead, Americans seem determined, many Americans, and particularly in the media and the Democratic Party, seem determined to suggest that we are on the verge of catastrophe always and forever. The catastrophe is coming. It's always 2 weeks away.